Do you want to know how minoxidil is used after hair transplant? If this is your query, please watch this video very carefully because we are going to discuss very important points about minoxidil in this video. We are going to discuss when to stop minoxidil before the hair transplant, when to start it again after the transplant, till how long you should be taking minoxidil after the hair transplant, how does minoxidil actually help in hair regrowth after hair transplant, what are the common side effects of minoxidil, and how we can use minoxidil in combination with finasteride after hair transplant. So these are the points which we are going to discuss in this video in detail. I am Dr. Satya Saraswat, a gold medalist plastic and cosmetic surgeon and an American board certified hair transplant surgeon in this field since 2006 and have performed many hair transplant surgeries and have trained around 100 doctors in the field of hair transplant. Please subscribe to our channel to keep on watching such very useful videos for you. So coming to the very first point, which is when to stop minoxidil before the hair transplant and why. So minoxidil, as you know, it increases the blood flow in a particular area. So if you are continuously using minoxidil till the day of the surgery, there are chances that the procedure is going to be very difficult because there may be excessive bleeding during the procedure because of the increased blood flow. So ideally, you should stop minoxidil at least 3 to 5 days prior to the hair transplant, and if you can't, then at least 48 hours before the procedure you have to stop. This step is essential so that your surgery goes uneventfully without any complications like hematoma, bleeding and excessive soakage and all those things. So this is very important for you to know that you have to stop minoxidil before your planned hair transplant. Do like this video for such useful information. Now coming to the very important point about when to start minoxidil after hair transplant. Friends, as I've told you that we have been doing hair transplant for last 17-18 years, there is no consensus in hair transplant surgeons about the time when you should actually start minoxidil. But with our experience, what I want to share is that initially we restarting the minoxidil around a week after the procedure, but we found out that the scalp was very sensitive, and since we have done so much of slit making and work and in that area, so the scalp becomes a bit sensitive. If you start it early, minoxidil, because of its preservative, which is propylene glycol, which is a sort of an alcohol derivative, you can have excessive stinging, irritation and itching if you start your minoxidil early. So what we started doing, that we started postponing it by a couple of days. So from 7 days we came out to 10 days and then restarted the minoxidil, but the problem still persisted. Then from 10 to we went to 15 days, but still many patients, around 10 to 15% of our patients still complained of the scalp irritation when we restarted after the surgery. Currently what we are doing is we are restarting minoxidil after 20 days of your hair transplant. By these 3 weeks or so, almost the scalp is completely normal. There is no excessive sensitivity to the preservative of minoxidil, which is propylene glycol. And initially what you can do is you start it once a day, probably during the evening hours or in the morning, whichever suits you. And then after 3 to 4 days, just observe if you're having that excessive irritation or burning sensation, then you can keep on applying it once a day for like 5 to 7 days or so. And then after that, you go to twice a day, which is the actual dose of minoxidil at which it is prescribed by the doctor. So this is our recommendation, that you should restart your minoxidil around 20 days post procedure. Initially for a couple of days, 5 to 7 days for once a day 1 ml, and then switch on to twice a day, morning and evening 1 ml. You can write your comment in the comment section below if you have a specific query about the use of minoxidil after your hair transplant, and we will try to clarify your doubts about it. Now before discussing till when you should be taking minoxidil after your hair transplant, let us touch on the way in which minoxidil actually helps in your hair regrowth. This is very important for you to understand the basic science behind how minoxidil works. First thing it does is that it increases the duration of anagen, which is the growing phase, and this growing phase can be from 2 to 6 years. So if you're using minoxidil continuously, your anagen phase increases, which is the primary treatment of the medical treatment. Apart from that, it increases a particular growth factor by the name of vascular endothelial growth factor. This again helps in the cell proliferation and increase in the hair growth. So this is again a very important growth factor which is increased in your scalp by minoxidil. Apart from this, it increases or stimulates the proliferation of your dermal papilla cells. This again leads to good hair cell formation in your hairs. And as the studies have shown that it also affects the potassium channel, and because of this potassium channel stimulation, this causes a relaxation of the muscles. These muscles, when they're relaxed, it increases the blood flow into that area, and this it does by the enzyme known as sulfotransferase. So friends, why I am touching on this is that sulfotransferase levels can be different in different individuals. That is why we know that minoxidil does not work in every person. The efficacy of minoxidil depends on the levels of your sulfotransferase enzyme, and if it is on the lower side, it's not going to work that well for you as it may work for many other patients. This leads to the individual variation in the efficacy of minoxidil and the variation in people. Now coming to the next point, till when you should be taking minoxidil or applying minoxidil lotion on your scalp in the transplanted area. Minoxidil has a half-life of 22 hours, which means that it stays in the scalp for a long time. The protocol which we follow is that we ask our patients to apply minoxidil twice a day for 1 year, 12 to 15 months, till the time we feel that there are new hairs growing. But once the full growth has happened or it is completed, then we switch over to once a day application, because minoxidil is there for a very long time and is not easily washed away out of your system, out of your body in just 12 hours. The half-life, as we have seen, is like around 22 hours. So after that, the full growth has happened. We just need to maintain the effect of minoxidil, and this then you should keep on taking as a maintenance treatment. You should not stop it, because there have been definitive studies which have shown that if you stop taking minoxidil, even your transplanted hairs can thin down over a period of years or decades. So our recommendation is, please keep on taking it. It's very simple to apply. It just takes 30 seconds to 1 minute for you to apply it. It should be a part of your hair care routine. If you are having a hair loss problem or looking out for hair transplant, you can call us at the numbers given here. And now let us discuss a very important combination of minoxidil with finasteride. Many of our patients are scared to take finasteride because of its side effects. They want to try it out in a less dangerous or less problematic way. Use a combined solution of minoxidil and finasteride in a lotion form, where generally minoxidil is in a 5% strength and finasteride is in either 0.1 or 0.25%. With this, when you start, you can see if finasteride is suitable for you, or are you feeling any side effects, any sexual side effect or other kind of side effects because of finasteride. So many of our patients start with this combination of minoxidil and finasteride, which is widely available with a lot of brand names, and then we ask them to keep on using for at least 3 months or so. It has been shown in some studies that the levels of finasteride can reach with the lotion form as with the tablet form over a period of 6 months or so. And if you are comfortable with the lotion application, this is a way where you can just use a single lotion and get the benefit of both the medicines. And if it is not working for you, then you can switch over to tablet form also, especially if there are no side effects. So this is a very useful combination for many of our patients, and please do start this only after discussing with your hair transplant doctor and not just on the base of the video. This is just a general information which we are providing to you about this combination, which is nowadays very routinely used by many of our patients on our recommendation. Please share this video with your colleagues or your friends if you think that this information is useful for either you or they are also looking out for such kind of information. If you want to know in detail about female hair loss, please click the video on the left, and if you want to see hair transplant results of our patients, please click the video on the right.